Hi, everyone, and welcome to the Muslim Sex Podcast. Thank you so much for tuning in. I really appreciate your patronage, and I would love it if you could leave me a 5-star review because that really helps me. And if you could like and share this episode with somebody that you know that may benefit, your friend, your colleague, anyone, I'd really love you to share this podcast, especially if you find value in the Muslim Sex Podcast. Also, I'd love for you to subscribe to my YouTube channel and follow me on all my social media. Also, as you probably know, if you've been listening to this podcast, is that I have a practice that is now open in Chappaqua, New York. I see patients for menopause and sexual health, as well as regular gynecology. So if you are looking for a gynecologist that actually spends time with you, that has time to listen to you, then I would invite you to come and see me in my practice, and I'd be more than happy to take care of you. So make sure if you live in the New York area, or even if you don't, come and see me in my office. I'd love to meet you. And also, last but not least, is that I am hosting again my retreat in Morocco for 2025. So if you are looking for a gift for a family member, a friend, yourself, make sure you take a look at our retreat, the Love and Nourish Retreat. It will be held September 19th through the 26th, 2025. Again, this year in Morocco, we will be visiting the same towns. We will be in Marrakesh and Essaouira. And as always, we will be providing information and lectures on menopause, perimenopause, nutrition, and also going for cooking classes as well as excursions. So don't miss out. I know a lot of people were sad when they missed out this past year on the Morocco retreat. So make sure that you go and visit the Love and Nourish Retreat hosted by Caria Retreats. And now onto the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about safe sex and romance and balancing passion with protection. So before I get into a few things I always make clear is definitely this is not meant to be any type of medical advice. If you have any questions about safe sex, make sure you speak with your healthcare provider, and definitely I'm not giving any type of religious advice. If you have any questions about your religion, please speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today, let's get into it and let's talk about this. I haven't really talked about safe sex and romance or anything like that. So it's a little bit of a new topic, which I hope you'll enjoy. So let's get into it. So at the time of this recording, it's actually January, but I do this special 4-week series on sexual health in the month of February, just because it's the month that's kind of associated with love and sex and romance and all of that stuff. So this is, by the time that you hear it, it will be February. And so let's talk a little bit about kind of the month, and, it's the month of love and hearts and everything romantic. And we're going to dive into this essential topic of safe sex, which of course everyone knows is super important. And so romantic love, let's talk a little bit about why safe sex is crucial for any type of healthy relationship, right? So we know that romantic love is built on trust, and that trust thrives when it is combined with care, with caring for another individual, caring for yourself. And research shows that romantic love has changed with our biology and our cultural systems for pair bonding. And so part of that bond involves protecting each other, protecting yourself, both physically and emotionally. And that's why it's so important. And we know that safe sex isn't just about preventing harm. It's an act of love and care that strengthens the relationship. So that's why it's so important. Consent. Okay, so we don't really talk about consent. And actually, you'd be surprised. Maybe you wouldn't be surprised. But when we have sex ed that is taught to our kids in high school or in middle school, consent isn't really taught. Most sex ed courses talk about, they talk about prevention of pregnancy. They'll talk a little bit about the physiology and what happens in puberty. They'll talk a little bit about sexually transmitted infections. But things that they don't often talk about is consent. They don't talk about intimate partner violence, and those things are definitely very important for sex ed. So let's talk a little bit about consent. So consent definitely is huge part of safe sex, and because we know that that ensures sexual activities that are mutually agreed upon, respectful, and free from coercion. And that's really the key thing. And consent protects autonomy and respect. It promotes clear communication. Of course, if there's something that you don't like, you're able to then relay it to your partner and let them know what the things that you like, what you don't like, all of those things. Discussing consent, of course, allows partners to express their preferences, their needs, their wants, their boundaries. All of those things are important. And especially in, let's say, if you were to practice kink, right, in your relationship, that consent is super important. And there's also things, and this episode is not about kink, but, just talking to you. But in general, consent should be a part of any type of sexual encounter that you have with anyone. And it's really, really important because it just shows that you respect that person, you respect the partner, and they respect you. It prevents coercion and misunderstanding, helps recognize and respect boundaries, which is really important. It's important to know somebody else's boundaries, and especially when you're trying something different, right? That's really important. Of course, since this is the Muslim Sex Podcast, of course, it aligns with our Muslim values of respect and accountability. And we know that Islam emphasizes mutual respect and dignity in marital relationships, and sexual intimacies based on kindness and considerations. And of course, in Islam, neither spouse has the right to force the other into any type of sexual act, and consent is key to a fulfilling relationship and also to ensure that there's compassion and mutual respect in that relationship. We know that consent, of course, reduces the risk of emotional and physical harm. It supports health and safety. And so it's super important to basically learn and educate yourself about consent and why that's so important in all your relationships, right, that you have, and about boundaries and communication. So, of course, consent also makes sure that sex is not physically harmful to anyone, and that it's a safe space for both you and your partner. So now I know that oftentimes, especially if in a new relationship, right, talking about safe sex can feel awkward, but it doesn't have to be. And that's why it's really important to break down that stigma. And just as we know that romantic love is universal, so too is open communication about health and safety in our relationships. In fact, there's a study that I was looking at that suggested that romantic love involves key facets of our life basically key facets for our life to work together, right? And those key facets are looking at our social, our psychological, and even our neural systems, right, that work together that promote pair bonding. And so communication is a key part of that. And it's really, really important to have that open and honest communication in your relationship. So when you approach the topic of safe sex with openness and empathy, then you're definitely able to connect with your partner. And of course, this is one of the foundations that love is built on. So there was a study that looked at what was the most important factor that was responsible for sexual satisfaction in a relationship. And guess what that was? I'm going to let you think. And yes, it was communication. So effective communication affected sexual satisfaction by creating emotional intimacy and informing partners of sexual desires. And we know that that's so important, right? And preferences. And just by being able to talk to your partner about this, and I know for a lot of people, this is really difficult to be able to have those open conversations, but especially if you've grown up with sex negativity. But, Being able to discuss your wants and desires increases arousal, desire, and orgasm in your relationship. And the study also mentioned compatibility with regard to sexual desires, sexual beliefs, values, attitudes, and perceived couple similarity. So think about it. When you are meeting somebody, right, for the first time, and as you get to know them, you start to talk about, all a bunch of different things, whatever, what you want your life to look like, where you see yourself, all of those things. But one of those key conversations really should be about sexuality and where and how you view it, right? Because if you come from a very sex negative background and the other person is very sex positive, that might be a little create some tension in that relationship, because one person may not be able to discuss their needs and wants and may have to do a lot of work to move toward that sex positivity so that they can have that open communication, right? And whereas that person that's more sex negative positive, they may not understand why this other person is not able to talk about their needs and wants, right? So that may lead to some frustration, anger, all of those things. So that's why when you're in a relationship and when you're meeting people, these are some of the key questions to ask. And I think that sexual compatibility is one of them, and trying to find somebody that is compatible with how you are and how you view sex, right? So really important. And what they also noted in this study was that sexually assertive women reported higher levels of desire, and the orgasm ability and sexual satisfaction. That kind of makes sense, right? Like if you think about it, if a woman is, or a person or whoever is able to discuss their needs and want, of course they're going to have more sexual satisfaction because their needs are being met, right? Or maybe they'll feel more frustration because even though they're telling the person what their needs and wants are, maybe that person isn't able to fulfill their needs. So, but it's better to know that kind of stuff ahead of the relationship, so that you know where the relationship is going, what areas you may need to work on and things that are important to you, to make sure that those are also important to the other person, right? Before you get too involved with that person, it's important to know if they're on the same page as you. So I think that that's really important. They found in this study, that sexual satisfaction was really significantly correlated with physical and mental health, and satisfaction with a relationship and marriage and general well-being of the quality of life. So sexual satisfaction, and I love this, was actually seen as a barometer of a relationship, right? So I want you to think about that. Think about how sexual satisfaction could be the barometer of your relationship or lack thereof, right? So really, I think that's food for thought. And, I'd really ask for you to think about that, and really have those open communications, right? You have that open talk with your partner and see where they feel, how they feel, what they feel, right? And see if you can have those conversations with them. Okay, some advice on just how to even get this conversation started, right? About when you're starting to talk about sex with your partner, you could be like, use like I statements and say like, well, this is what, I feel, and this is what I value, and, how I'd want to feel safe in our relationship, right? You can frame the conversation as an act of care. So when you're talking about safe sex in your relationship, you could, put it in that context of being cared for, right? And you want to make sure that both people are safe. And you don't want to forget to listen. Love is always a two-way street. You want to make sure that, when you talk, you speak clearly. And when you listen, that you actually listen. You're not just hearing them, but you're actually listening to them so that you understand what they're trying to say. Right. So when it comes to safe sex, one of the key components of safe sex is contraception. And whether or not you're trying to get pregnant, and if you're not, then what are your options? And some people feel that, using contraception can affect spontaneity. And I would say that actually using contraception or using something that makes you feel safe in that relationship is actually the smarter way to go, right? Because sometimes people have a lot of regret when and if they're not able to, they don't use protection, or if they made some decisions while they weren't thinking clearly, And now there's consequences sometimes to actions. So really important to kind of think those things through. So let's go over just really quickly what different types of contraception options there are. And I will have you know that I did an episode of this. So I can't even believe I've been doing this now for 4 years. Can you believe that? But in 2022, when I first started this Muslim Sex podcast, I did an episode on contraception. So if you're looking for even more detail than what I'm going to tell you now, maybe go back and take a listen to that episode, and you will see the difference in my podcasting. Right, you'll see that I barely looked up, I barely made the eye contact. So that tells you what 4 years of podcasting will do for you. So if you're thinking about podcasting, do it. And do it with Alan, actually. Pretty easy podcast. He's a great guy. Okay, anyways, let's go on now to contraceptive options. So there are definitely lots of contraceptive options, and you just have to see what works best for you. If you are thinking about contraception, see what's going to be easy. Find something that you're going to be able to use all the time, right? And find what the pros and cons of it are, and see what is it that you're looking for in that contraception, right? Is it just prevention of pregnancy? Is it prevention of pregnancy and prevention of sexually transmitted infections, right? And then find the contraceptive that addresses all your concerns. So that way, then, there's no question in your mind if you're taking care of yourself to the best of your ability. Okay, so let's get started. So one is you have the barrier methods, right? So there's condoms, there's the male and female condom. Condoms are a great way to protect against sexually transmitted infections. They're available without a prescription. That's why they're so great. They're inexpensive and easy to use. You can get them at some of, the clinics. I think Planned Parenthood, perhaps you can get some condoms. I know that when I worked at a clinic, they had condoms that they would give out. So they are pretty accessible to most people. One of the cons may be that, maybe it breaks or slips during use, or it can, for some individuals, they complain that it reduces the sensitivity, right, the sensation. And that's a single use. Once it's done, and right, you throw it away. There's also the diaphragm and the cervical cap. I will also get into different types of condoms. And I don't know if it's with this episode or if there's another episode, but I go into different types of condoms as well, and lubricants. So we'll get there. But this is just kind of a quick overview of the different types of contraception. You have, of course, the diaphragm and the cervical cap. The pros of that is that it's reusable for up to 2 years with proper care. There's no hormones involved, can be inserted hours before intercourse. The con is that sometimes, you need to get fitted by a healthcare provider. It may be less effective if it's not used with spermicide, and it doesn't protect against sexually transmitted infections. So really, you just have to know what your goals are when you're using this, right? There's hormonal methods. We have the birth control pills, which are very commonly used. We know that we use birth control pills all the time as gynecologists. And we use them for different reasons. They can be for contraception. It can be for, irregular menses. It can be to control acne, lots of reasons. But anyways, it's highly effective when it's used correctly. Like I said, it can regulate your periods. It can help with acne and reduce some menstrual cramps. It can also reduce the risk of certain cancers. So there have been studies that have shown that it can decrease the likelihood of ovarian cancer. Cons are that it must be taken around the same time. It doesn't protect against sexually transmitted infections, and possible side effects can be nausea, mood changes, and weight gain for some people. The birth control patch. So there is a patch. It only needs to be changed weekly, and it's similar hormonal benefits to the pill. The con of it is that sometimes people can get an irritation if they're allergic to the adhesive, or maybe, it causes a skin reaction. So that can be a problem. So when we are talking about the birth control patch, it may not be as effective for individuals that are over, actually, it says 198 pounds. So, right, close to 200 pounds. You may not be able to take the patch. So really important to know what it is that you're looking for, and also to see if that contraceptive method works for you in your life, right? The vaginal ring. So there is an estrogen, a Nuva ring that is both estrogen and progesterone. It's inserted monthly. It's easy to use. You just put it inside the vagina, but it can cause some vaginal irritation. But to be honest, I haven't seen too many people complain of vaginal irritation, but I guess that's something that to be aware of. And it has to be replaced monthly. There's also the Depo-Provera shot. Now, I'll tell you, I do not like this at all. I do not like Depo-Provera, and I'll tell you why. Because it causes a lot of menstrual irregularities. Sometimes people are spotting like for 3 months. Sometimes they don't get a period for like months after use. Some people gain tons of weight on this Depo-Provera shot. And other times, women, if they've been taking it for over 2 years, it can start to affect their bones because it kind of puts you in this menopausal state. And so you have to be really careful on that. It can cause some vaginal dryness. So many reasons. But you know what? Listen, if you want something that is going to protect you from having a pregnancy that is unplanned and that's what you like, then you like it. And end of story, no big deal. But I'm just talking about why I don't like it. I just find that those that, come off of Depo, their periods sometimes are like irregular for like months. And so it's difficult to really plan, like if you're thinking about getting pregnant right after that, sometimes ovulation may not return. And I believe I read for sometimes for, depending on how long you've been using Depo-Provera, but sometimes people, ovulation may not return for like a year to 18 months, right? So you just got to decide what works for you. And if Depo is going to work for you, then use it. And it's going to prevent pregnancy. And if you don't want a pregnancy, then use that. But the Depo is an injection that you have to get every 3 months. You have to go to a clinic or a doctor's office to get it placed. And like I said, after long-term use, it could affect your bones. There are also long-acting reversible contraceptives such as IUDs. We have two types of IUDs. We have the copper IUD that has no hormones, and then you have the hormonal IUD that has progesterone only. And depending on the type of hormonal IUD you get, it can stay in the uterus between 3 to 7 years. So just important for you to look that up. Depending on which one you get. The copper IUD now, I believe it can stay in for as long as 12 years. So really important, depending if you want that. But also know with the copper IUD, sometimes women can have heavier periods. So important for you to know that. With the hormonal IUD, what can happen is that sometimes you get lighter periods. Some people don't get periods anymore at all after that. So important to know what it is that you're looking for. There's also the Nexplanon, which goes into your arm. It goes into your upper arm. It lasts for up to 3 years. Now they're saying it can even last up to 5 years, but definitely check where you get it placed and see what they say and just follow those directions. It can definitely cause irregular bleeding. And I will tell you that is the number one reason why people remove this Nexplanon is this irregular bleeding. Like, honestly, I've had people like that have gotten it placed and then 3 months later, they want it removed. And I'll be like, but you knew it caused irregular menses, but I guess they just don't realize how bad it's going to be until they get it placed. And then they have this irregular menses or this bleeding, heavy, like whatever, and unpredictability. But eventually it kind of figures itself out in your body. But, that can be up to 6 months. So if you're not okay with that, then I would definitely not get that next one on. Because it is a procedure. It's a procedure to get it in and then also to have it removed. And here in the US, it's one rod. But in some foreign countries, there are actually 2 rods that go in the upper arm. So important to know that it is a procedure to get it placed. And of course, there's permanent methods of contraception. There's the tubal ligation. There is a vasectomy. Important to know what those are and, what you desire. And of course, there are some people that use natural method for contraception. And that is something that honestly, I don't know. I just feel like sometimes people have irregular menses, right? So like if your periods are not regular and you're thinking that you're going to just do this natural method and track your ovulation, and you're not going to get pregnant, I don't know. But that's, that's up to you. And you have to see if that's something that you want to do. So you go the natural method, you look at, you're tracking your ovulation. You want to look at, the pro of it is that definitely it's hormone free, right? You're just tracking your ovulation. It can be inexpensive if you just download a free app on your phone. It really is important though that you have regular cycles, right? Because if you have irregular cycles and you're trying to figure out when to have sex and you don't want any type of protection, whatever, you could possibly ovulate and then you get pregnant, and then that's another story. So see what it is that you want, and if your periods are regular, then I would say sure, go ahead with it, and track your ovulation and do that fertility awareness. Withdrawal method. Now, this method, I'm telling you, I do not like this withdrawal method. And a lot of women have their partners use that withdrawal method. And it's always available, right? It's there. You can do it. No cost or tools required, but it does have a high failure rate with typical use. And of course, it does not protect against sexually transmitted infections. So you just have to see what your goals are, right? You see what you want, and if that's gonna be what you want, then you just have to know what the risks are to it. Emergency contraception. So this is something that obviously is not a form of contraception that you'd want to use all the time, but it does happen, and there are people that use it, and that's why it's there, right? That's why we have emergency contraception, is for when if the condom breaks, if you didn't use a condom, if whatever, it can protect. So there are two types. There's the morning after pill. And actually, you can also use a copper IUD as a form of emergency contraception, which not a lot of people know. So it's important that you know, because you're a fantastic listener to my podcast, and you will know that the copper IUD can protect, is used as a form of emergency contraception. And the great thing about using a copper IUD is that you can leave it in, right? It's contraception then. And now you have something that you can potentially leave in for 12 years. So that copper IUD, if you decide to use that as a form of emergency contraception, can be inserted up to 5 days after unprotected sex. And of course, like I said, it doubles as long-term contraception. It requires a healthcare provider, so you got to go to a clinic, you got to go somewhere where you can get this IUD placed. And it's a higher upfront cost, obviously, because if you're going and seeing a physician to get this IUD placed, then it's going to be a visit, you're going to be charged. The Plan B. So what's great about the Plan B is that it's available over the counter, right? It can protect you from unwanted pregnancies. It's less effective the longer you wait. So it's best used within 72 hours of unprotected intercourse. If you wait longer than that, then it may not work as well. It can, of course, cause nausea, fatigue, and definitely what I see is irregular period right after somebody uses this. They'll notice some bleeding, and they'll notice like these irregular menses. So important for you to know things that work, things that don't work, and what you're looking for, right? So if you're looking for, and so this whole episode is about safe sex. It's about consent. It's about knowing what your options are. And I just went through all of those contraceptive methods. You have to see what works for you, what you're looking for. Are you looking just for protection from sexually transmitted infections? Are you looking for protection from pregnancy? And see what works for you. And remember that not all contraception protects against sexually transmitted infections. Like an IUD is not going to protect against STIs, right? The implant is not going to work. The next one on is not going to protect you from sexually transmitted infections. So know what it is that you're using and know what it protects you against. Okay, so that's it. I'm not going to talk about this contraception on this episode anymore, but I just want you to know and just be aware. So that's the key thing. Okay, so let's talk about a little bit about condoms. Okay, so there's different types of condoms. There's latex, there's non-latex, there is lambskin condom. Let's just see what types of condoms there are and what they do. So it's the latex condom is the most common type of condom, and it's made from latex rubber, right? Highly effective in preventing sexually transmitted infections when used correctly. It's affordable, it's available, and it's durable and flexible. The problem with latex condoms, as you may realize from the name, is that not everyone can use latex, right? So there's some people that are allergic to latex, so make sure you know. It can be damaged by oil-based lubricants. So that is super, super important. So especially If you're going to use lubricants, and there's an episode that I talk about lubricants coming up, but make sure that you know that latex condoms and oil-based lubricants do not mix. So really important for you to know that. And of course, we talked a little bit about the sensation that people complain about. Now, the next thing is non-latex condoms. So those are suitable for people with latex allergies, obviously, right? You probably are thinking, of course they are. They are often thinner and offer more sensitivity. They're compatible with oil-based and water-based lubricants. Okay, so that's good stuff to know. They're generally more expensive than the latex condoms. Sometimes they are less elastic. The polyurethane condoms are less elastic, increasing the risk of breakage. So just know that. And they do not provide as much protection as for sexually transmitted infections as latex condoms. Next is your lambskin condom. So this is like this natural membrane, and it's made from the intestines. Okay, so just remember this intestine membrane of lambs. I know it sounds kind of weird. Pros. So it provides basically a natural feel. So that a lot of times people, that's what they want, right? They just want this natural feel. It's often preferred for increased sensitivity when they use these lambskin condoms. It can prevent pregnancy, which is obviously a big concern for a lot of people that use condoms. And it's biodegradable, which is fantastic. The con of it is that it does not protect against STIs. So I will repeat that. Lambskin condoms do not protect against sexually transmitted infections because they are porous. So they have these tiny little holes in them and they allow viruses to pass. This is important. So star it, whatever you need to do to remember that lambskin condoms do not protect against STIs. They're expensive and less widely available. I don't really know if I've seen them, to be honest, around like in Target or CVS. I don't know. Maybe I just haven't really paid attention. That could be it too. And they may not appeal to vegetarians or vegans, which makes sense, right? Like if it's lambskin, they're probably not going to want to use them. Okay, next. Internal female condoms worn inside the vagina, typically made of nitrile. They can be inserted hours before sex, provide protection against STIs, latex free, suitable for those with allergies. The cons are they are definitely more expensive than the male condoms, maybe harder to find in stores, and some users just don't really think they're comfortable. So, depending on what you want. Lastly, there's so many other condoms. There's like flavored condoms and glow in the dark condom. I'm not going to really get into that, but the last one that I'll talk about is spermicidal condoms, which are coated with spermicide, and they, usually non-oxynol 9 is used to kill sperm. So it offers just an extra layer of protection against pregnancy, which is great, right? That's why a lot of people use condoms. Spermicide, though, it can cause some irritation or an allergic reaction. So you got to know what your body, is going to be able to tolerate. So that's something that may be of concern. And the frequent use may actually increase the risk of STI transmission due to irritation. So all that spermicide, good to know, right? It has a shorter half-life, a shelf life than regular condoms. So anyways, the whole reason why I brought this up, and I think it's important, is because just so you know, you have options, right? There's different types of condoms. You got to see what it is that you're looking for. And, they're inexpensive. You don't need a prescription. They can help you prevent pregnancy. Most, of course, we know the lambskin one did not protect against STIs, but most of them do protect against sexually transmitted infections, right? They vary in size, materials, and you just have to look at what your preference is. The general cons is that, depending on what type of condom you're using, some people can't use those condoms. And it can reduce some sensitivity for some users. The risk of slippage and breakage is a possibility if they're not used properly, and requires consistent use for effectiveness, which is really important. Next. So really quick, we talked about, so what are all the things we've talked about so far? We talked about consent in this episode. So we're talking about safe sex. We talked about consent. We talked about, how to bring about that conversation of consent in a relationship. We talked about contraception. We talked about condoms. And I'm going to, I feel like that is a lot just to kind of take in and look over. Couple things that I did want to go over really quickly as we're talking about safe sex, right? There are things that you should know about, and one of the things is sexually transmitted infections, right? Which ones are they? What are they? I'm not going to get into all of the details because I feel like that would be a really long episode. So let's just talk about the most common sexually transmitted infections that people may be exposed to, and what they can do about it. So one of the number one STIs that we see in the clinic oftentimes is chlamydia. And people sometimes will present with discharge, but you know what? I'll be honest, not everyone presents with discharge, and not everyone knows that they've been exposed to it. Sometimes it just shows up if we've done a vaginal culture for like vaginitis, or if we've done a pap smear and your practitioner picked the pap smear that you can see if they've been exposed to STIs. Like there's a pap smear that we can run that also will look at things like gonorrhea, chlamydia, and trichomonas. And so that's dependent on your practitioner. But anyways, so chlamydia. People can have discharge, they can have burning. And, the thing with chlamydia that's really, really important, I want you to remember this, is that with those that have been exposed to chlamydia, if they are not treated, it can have long-term effects, and it can affect your fertility, right? Because it can cause this inflammation of the tubes, and it can be a big problem for those that are trying to get pregnant. So I would say that, with your yearly exam, if you are not in a monogamous relationship, or even if you are, you may want to just get tested for gonorrhea, chlamydia, trichomonas, just for kicks, just to make sure that you don't have it. And especially those that are younger, because you want to make sure that if you've ever come into contact with it, that you get it treated, because you don't want it to affect your fertility. So, that's why I think that's really important. Gonorrhea is also something that can affect your fertility. And both gonorrhea and chlamydia, unfortunately, tend to come together. So really important that, and what happens in the ER is that sometimes when people come in with pelvic pain, and if the ER doc or the urgent care thinks that you've been exposed to, or, based on the history, that if you've been exposed to gonorrhea and chlamydia, they'll actually treat you for both. So that's important to know that, we will always screen for both together if we're thinking that you may have chlamydia, and that oftentimes they'll treat you for both because they don't want it. There's no harm in being treated for it, even if you didn't have it. Let's say that you just went in for pelvic pain, you had this discharge, and this, clinician thought that you had gonorrhea or chlamydia, whatever. If they treat you, there's no harm in it. But if they don't treat you and it goes on and you had it, they'll know though that you had it, especially if they took a sample or whatever, sent it out to the lab. But say somehow they missed it, that can affect your fertility. So really important to be treated. Okay, really quick. I don't want to take too long with the sexually transmitted infections, but I just kind of want you to know that they're out there, and just so that you protect. And all the more reason to practice safe sex, right? Because that all goes together: consent, protection, contraception, condoms, and, infections, right? That's just kind of the whole thing. So let's just make sure we go over it. HPV, so human papillomavirus, is the most commonly sexually transmitted infection in the world. Did you know that? I didn't know that. So it's important for you to know that. Key facts about it, just the prevalence: it affects millions of people globally. It's estimated that more than 80% of sexually active individuals have had some contact with HPV. So unless you've only have had one partner your whole life, and they've only had one partner their whole life, the likelihood is that you'll probably be exposed to somebody that's been exposed to HPV, or they have HPV. Transmission can be spread through vaginal, anal, oral sex, skin to skin. Any skin to skin, contact in the genital area can cause spread of it. There's over 200 types of HPV that can cause. There's some that can cause genital warts. There's some that can cause cancers. We always advocate for women to get pap smears after the age of 21. And what pap smears do is they are a cervical cancer screening tool that we use to see whether or not you've been exposed to the HPV virus. And if you have, then there are certain things that we ask you to do. So really important to go and get your pap smear done, right? You know what the amazing thing is, though, is I will tell you there is a vaccination. So if you have a child that can get vaccinated for HPV, get it done for them. If you are an individual that can get the vaccine, get it, because the vaccine protects against the most common high risk and wart causing strains. So important. Okay. We know that condom use reduces the risk, but does not provide full protection. And since HPV can infect areas not covered by the condoms, important just to protect yourself as much as you can, right? Okay. Next, we have herpes, which people can get painful blisters, genital sores. If you've seen one, let me tell you, you won't forget it. It is so irritating to the individual and so painful, and it burns. It really causes a lot of pain. So really important to go get treated. And please, if you have an outbreak of herpes, please do not have sex with somebody else because you are so infectious at that time and you're going to give it to that other person. So please, if you have herpes outbreak, please do not have sex with anyone else at that time. Okay. It's not good. And you are not doing them a favor and you are spreading that virus. People can get flu-like symptoms during the first outbreak. People typically get like a prodrome of like itching and burning before the sores appear. And of course, there's no cure for it. But we do have some. So like, this is what I mean by there's no cure for it. Once you have herpes, you will always have herpes. It stays in the dorsal ganglion of the neurons and it can become activated. Okay. However, we do have antivirals to control the symptoms. And if you have an outbreak, so definitely go get treated. But know that once you have herpes, you always have it, unfortunately. Syphilis is caused by bacteria and lots of things with that. So make sure if you're going to go get STD testing, make sure you also get tested for syphilis, okay? Because syphilis, unfortunately, is on the rise here in the US. So, and we're seeing it a lot in pregnant women. I'll be honest, when I was a resident, we didn't see it as much in patients at that time, but now it's really increased. Trichomonas is something that we also see. We can see that on pap smears if your doctor's looking for that, or there's a culture that looks at trichomonas. So, again, I'm just listing off infections that you can be exposed to if you're not practicing safe sex, or even if you are, but you can, still, but you need to just protect yourself, right? And you need to be aware of all the different ones. And of course, we can't have a lecture about safe sex without talking about HIV, right? There are, different stages to HIV, really important to protect yourself. There's no cure, but there are antivirals that suppress the virus and maintain health, which is fantastic. I was working at a clinic and I saw actually quite a few women that had HIV that were exposed to HIV. So really important to get tested at your annual health exams if you are in a non-monogamous relationship. If you're worried about it, definitely go ahead and get tested. Hepatitis B, there's a vaccine that can prevent it. There's acute infection, chronic. So those are the most common ones. I just want you to be aware. I want you to, when you think about safe sex, think about consent, think about contraception, think about protection, think about viruses, think about all of these things put together and just be informed, right? That's the key thing. Knowledge is power. So you're going to be informed. You want to know what your risks are and how you can protect yourself. And that's really the key point and the key takeaway from this podcast. Remember to always try to have these open discussions. There are people say that condoms kill the mood. The fact is that studies show that condoms have minimal impact on pleasure, especially when couples choose the right type. Protection means you don't trust your partner. That's another myth. The fact is that using protection shows you care and that you're responsible, which are key components to love. Another myth is that only some people are at risk for STIs. The fact is that, lots of people are at risk for STIs, not just, some. So I think that safe practices are for everyone and really important to be aware of that. And by understanding and addressing these myths, you can have these open conversations with your partner, which are super, super important. And remember that protecting yourself and your partner is an act of love that allows intimacy to happen without fear. And safe sex, of course, doesn't take away from the passion. It enhances trust and care. So it's really important to stay informed and empowered about your own health, your own sexual health, so that you can have agency over your body and practice safe sex practices. And well, I am done here, and it's been real and really intimate. And I hope you learned tons of information on all of this stuff. And we'll be sure to always use safe sex practices. And this is not meant to be any type of medical advice. So if you have any questions about your health, your sexual health, make sure you go see your doctor. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.